generally for an immediate on-site analysis and result, the two main options are urine analysis, UDT as it's called, urine drug testing, or saliva, oral fluid testing. So those are the two main areas that you would look at in terms of if there's an immediate risk presented, or if you're attending regularly and you'll be regularly tested, and let's say once a week or twice a month or something like that. So urine has a smallish window of detection. We talk about windows of detection in terms of when you would expect to find a drug or alcohol in someone's system, because this is what rapid on-site testing looks at. It's whether the drug is still present within the body. Your body, if you consume alcohol or drugs, your body treats that as toxic, as a poison, and it wants to get rid of it as quickly as it can. And this presents challenges for on-site rapid testing because your body wants to get rid of this drug as quickly as it can. Sometimes that's hours, sometimes it can be days. Cannabis is a little bit different. So if you're looking for something longer than hours or days, urine, saliva might not necessarily be your best option. And really with urine testing, there's certain requirements that you should follow. So you should use kits with temperature and adulteration strips to identify if they've been tampered with, really. And the other problem with urine testing is that it really should be observed. And I know that it isn't always observed. You would just send them away to the toilet to give a sample, and that's not really the appropriate way of collecting a urine sample because it can be adulterated if that is the process that you follow. If you're not actually watching them give a urine sample, then you can't be 100% sure that the sample they give you is their own urine sample. Obviously, then you've got the issue of having male to male and female to female positions where this happens. So urine, although it's relatively easy in terms of collecting a sample, it presents challenges. So the other way you could look at this is urine, saliva, or fluid testing. Again, this generally gives you hours worth of detection. So again, saliva, your body will get rid of drugs quickly in saliva, more quickly than urine, because obviously urine stays around in your bladder for a little bit longer. And so therefore the window of detection is slightly bigger. It's less invasive, obviously, so it's ideal for a community setting. But there are sensitivity challenges. It requires, because it's only a very small window, and because a lot of the saliva oral fluid testing kits are not really that sensitive, they're not really that specific in terms of identifying the actual drug, as opposed to a compound that's very similar and maybe is not an illegal drug or not a prescribed drug. So you've got sensitivity and specificity challenges. And really, you would only expect to maybe find a positive oral fluid test if they had just taken quite a large amount of the drug or alcohol just prior to you attending site. So that's a major challenge. And obviously you've got protocols with oral fluid testing as well. You really should make sure that they haven't smoked and that they haven't eaten or drank anything for at least 10 minutes prior to you doing the test. So that obviously involves you maybe waiting around for a little bit longer. Fizzy drinks can potentially cause a bit of an issue with oral fluid testing as well. So they're particularly important. So for these two, obviously in terms of the cost and the convenience up to a point, they are, there is a tick in the box for that, but you need to be mindful of the challenges and the limitations of these products.